Hi, I'm Jane Lemaire, and I'm a clinical professor of medicine at the Cummings School of Medicine, University of Calgary. My main role right now is working in the field of physician wellness. For the last 15 years, we recognize there's a really important need to address the wellness of physicians because of the work that they do. They're at increased risk of things like burnout and worsening mental health issues. We don't treat distressed physicians, but we educate. One of the ways that we do that is through a podcast series. In particular, during COVID, this was a really important way to support physicians, letting them know that they're not alone, helping them understand how COVID was affecting their work and their mental health. We've now trained 12 peer support teams across the province. Over 200 physicians are formally trained as peer supporters. It's important to address burnout in physicians in terms of cost to the healthcare system. Our vision statement is shaping the future of physician wellness together. The whole goal for us is to support physicians in their work, support healthcare systems in having high quality healthcare delivery, and then that results in great patient care.
I'm Jim Silvius. I am a geriatrician here in Calgary. It's interesting that I started life going to be a pediatrician, and I was very close to my grandparents, and they diverted me by what was happening to them in the healthcare system in the States, actually, into geriatrics, and I've never looked back. Universally, people are very grateful that we have the navigation system in place that we have. It allows them to not have to worry about the details, and we find very much that families after the fact are very grateful they have had that made available to them. All through my career, my work has been related to trying to improve the lives of older adults. And if you think about the lifespan of all of us, at the end, we will all die. And it is critically important, as it has been in my work with geriatrics, to ensure that there is an appropriate death for any individual where they are supported, they are in the greatest comfort that they can be, their families are supported through that final journey, and that we have that accessible across the province.
I focus on trying to ensure that children and youth have no barriers to their access to preventive medicine. We have to acknowledge that there are problems and work together. And adult interests should not dominate. And they do. For some reason, elected officials think that an adult interest should count. It's what adults want rather than what children need should count the most. And I'd like to invert that so that what children need is the dominant factor in the minds of elected officials when they make decisions about preventive health care for children. I feel that we have to continue to build the best possible city and province and nation that we can, and all of us have to pitch in. Children are the future of our city and province and nation, and we have to help them have the best possible health that we can give them so that they can do great things for Calgary, for Alberta, and for Canada.
I started nursing in Black Diamond. There I met my husband, Alan, who was a clerk at that time. He was quite concerned about how there was lack of people going into rural medicine. How do we entice students into going into rural medicine? Why don't we just throw them on a bus, bring them out here, and let them see what rural medicine is all about? I know of so many towns that don't have physicians. People have to travel miles to go and see a doctor, and that shouldn't be. That just shouldn't be. I think it's really important that we, through these programs, have managed to keep Alberta viable. If you lose a physician, you lose the town. So I'm glad that we have been able to manage to keep this going and to keep Alberta viable. Doctors in general, they come out here and they get to practice full scope medicine. You know, they get to deliver babies, sometimes they get to do surgery, they get to do emergency, they get to see patients and their whole families. People that come out here and they experience it, they go, wow. Anywhere in rural Alberta has got beautiful scenery. Wouldn't you want to wake up every morning and go, wow, I've been blessed? And that's what I sort of wish for any rural physician and their families, to be blessed like this.
Hi, my name is Monty Ghosh, and I'm an addiction physician in Calgary and Edmonton, working with those who are vulnerable. What many people don't know is that homelessness and health intersect. They're very much attached to each other, and one does impact the other. What I discovered while looking in my own backyard was that there was a high level of needs here in the community. Living in Calgary, we don't often see the darker side of our communities, or what's deemed as the darker side of the communities. Homelessness is a very complex issue and requires a multifaceted approach in dealing with it. The Calgary Drop-In Centre is an access point that goes beyond just providing shelter to our clients. It helps clients access supportive housing facilities, helps them access income supports, and gets them to access other resources in the community, including mental health, addiction supports, and healthcare supports. Our population didn't come here by choice. They're often placed in the situation through other circumstances, whether it's the social determinants of health, whether it's trauma that they faced in their childhood, whether it's just the way the society has dealt them these cards. They're here because of circumstances out of their control, and it's important for us to help them and recognize that this is the reason why they're here in the first place.
I deal specifically with children with chronic complicated lung disease, a variety of these illnesses. We are supported by a large number of staff members, nurses, therapists, social workers, who are part of a team helping the families. So everything we do is as part of the team as we help the families. Our intention in pediatrics is to have the best possible adult from the child we have before us. So it's very important for us to maximize the benefits of our interventions in children. If we don't do that, then we impair their ability to have a happy, productive adult life. Although we deal with undoubted sadness and unhappiness in children and families, there is a certain joy in working with children and families that the future will be bright and we'll be able to do more for them as the years go on.
I'm Dr. Vera Krajcik, and I'm a psychiatrist here in Calgary, Alberta. I work primarily with couples and families where there's comorbid physical health conditions, so often disability, and mental health challenges. When I became disabled years ago, I just sort of found a lack of voice for disabled physicians, and thankfully I reached out to a small organization, the Canadian Association of Physicians with Disabilities, and realized, man, there's others like me, and really pushed for more policy and other ways to support those of us out there who were struggling to fit in within the medical culture. Physician advocates are particularly powerful because you can understand things through both a patient lens at times and a medical lens. So, for example, physicians with disabilities, you know what it feels like to be a patient. And so, in addition to having that medical knowledge, you can speak from an advocacy lens, from a place of knowledge, both from one side of the gurney and the other, right? So it's a kind of a more potent and, in my view, effective advocacy.